What if science could rewrite your DNA to cure a deadly disease? In just 6 months? That's exactly what happened to baby KJ, and it might change medicine forever. KJ was born with a rare and life-threatening condition called carbamoyl phosphate synthetase 1 deficiency, or CPS1. This disorder stops his body from breaking down nitrogen into urea. That causes ammonia, a toxic compound, to build up quickly in the blood. Even small increases can lead to brain damage, coma, or death within days or weeks. Imagine your body as a city. The nitrogen waste is like garbage. In KJ's case, the garbage trucks stopped working. Ammonia piles up and it's poisonous. Traditionally, children with this condition rely on strict diets, medications, or even liver transplants, none of which offer a real cure. But doctors and scientists at Beam Therapeutics and UMass Chan took a radical step. Fix the genetic typo using CRISPR-based editing to fix KJ's DNA. You might have heard of CRISPR, a tool that acts like molecular scissors to cut DNA, but cutting is risky. In base editing, scientists can change a single DNA letter, like switching a G to an A, without making a cut. It's precise, elegant, and powerful. Think of it like fixing a typo in a book without tearing out the page. Unlike regular CRISPR, which cuts the DNA, base editing changes a single letter in the genetic code, precisely, safely, and without breaking the strand. With KJ's life on the line, a team of researchers and biotech companies created a personalized therapy targeting his exact mutation using CRISPR. This was not a one-size-fits-all treatment. The therapy was designed just for KJ. Scientists analyzed his mutation, developed a custom editor, tested it in lab models, and delivered it, all in just 6 months. Everything had to go right. And it did, says a researcher at UMass Chan. After the treatment, KJ's ammonia levels stabilized. He's off dialysis. While doctors say it's too soon to call it a cure, this treatment gave him a fighting chance, something most kids with this disease never had. His parents say he's alert, smiling and beating the odds every day. This milestone shows that personalized genetic medicine is no longer science fiction. There are over 400 million people worldwide with rare genetic conditions, most of them untreated. This case could open the door to new cures, one patient at a time. Could this be the future of curing rare genetic diseases? The science says yes, but the challenges ahead are just as real. How do we scale treatments made for one patient at a time? Who will be able to afford them? And as these therapies remain experimental and incredibly expensive, we have to ask, who gets access? How do we regulate this new frontier? And how do we ensure that innovation doesn't deepen inequality? Would you support gene editing if it could save a child's life? What if that child were your own? Tell us what you think in the comments below. And don't forget to like, subscribe, and hit the bell to follow Science Sparkles, where science meets the stories shaping our future.